We're good, right? Okay. I think so far we've confirmed that it looks like we're live and on. All the people in our area are preparing for a huge snowstorm right now, so hopefully everyone's ready for that, and it's a good time to hunker down and watch a little webinar. We're excited about presenting this new topic here in this practice. We just started offering BioTE hormone replacement this year. The whole team has been trained, and I'm allowed to say that the whole team has been pelleted. So I'm going to give you as much information as I possibly can this evening, but also you're welcome to ask any of us about our personal experiences, about how we felt before and after, and anything you want to know. As you know, we're pretty open around here, and we're happy to share any information that might make others feel better. So this is about hormone replacement, and these little tiny pellets are the hormones that we're talking about. We're talking about testosterone and estrogen, and we're going to go through the details of what works and why it works. And as usual, you can ask me questions during the presentation. I'm happy to answer anything that I can answer on the fly, and also at the end, I'll kind of keep checking to make sure I'm not missing anything. But let's get started. So there's a lot to cover. And I'll mention this again at the end, but I would welcome anyone who thinks that they're interested to pop by the office and grab one of these books. We have a whole stack of books in the office, and this will give you all the pertinent information of what you want to know. And we're happy to give you one and help educate you on this topic. So definitely pop in and grab a book. And through this evening, what we're going to do is talk about what are the hormones, how do they work, why do we need them, what are the ways that they make us feel when we have too much or not enough. We're going to describe the difference between different types of hormone replacement and why we're focused on giving bioidentical hormones and the mode in which we're giving them. We'll also discuss different medical conditions that can be helped with the addition of these hormones. And we want everyone first and foremost to feel well, but we also want to do any disease and illness prevention that we can do by kind of optimizing all of us. Any kind of frequently asked questions or concerns we'll talk about, and then really kind of narrow down on what the key points of tonight's discussion are. So welcome, and let's go. So first and foremost, what are hormones? We're going to discuss mostly testosterone and estrogen, but there's chemical messengers that are swimming around our bodies all the time, talking to each other and making all of our cells function properly and also function in concert with one another. That's what keeps us in balance on a daily basis. And the question has always been, are we aging because we have less and less of these hormones, or are we just losing these hormones as a process of aging? It's kind of the chicken, what came first, the chicken or the egg kind of thing. But we know that these hormones are responsible for a lot of the symptoms that people are experiencing as we age. And the biggest question that we want to know is, how are you feeling? Do you need to feel better? Are there things that are bugging you every day? Are you feeling more like this? I don't need to describe what this feels like. You can see that none of this feels good. Or feeling more energetic, more enthusiastic, sleeping better, higher energy. And this is what we're all trying to achieve. And I think a lot of these symptoms that we're talking about are things that many of us just feel on a daily basis. So just regular garden variety fatigue that people have, mood swings, anxiety, tension, irritability. You hear people describe they're not as tolerant as they want to be, either of partners or children when they get home from work. Just generalized not being able to sleep at night, waking up a lot, memory loss, anxiety, depression, brain fog. These are things that are familiar to a lot of people. And if there's something that we can do to make any of these things feel better, let's do it. One just quick aside about andropause. I would guess that most people that are listening right now have heard of menopause. Most of us know that that's as we age and our estrogen becomes depleted, we go through menopause. Andropause is what happens with depletion of testosterone. So it's happening to men as well as women. It's just not as discussed as much for men as it is for women. But andropause is decreasing testosterone production over time. And actually, both men and women experience loss of androgen production. And androgen specifically, what we're talking about is testosterone. Physiologically, both men and women make testosterone and estrogen, but specifically with testosterone, men obviously make a whole lot more than we do, and most of them by the age of 60 have pretty low testosterone levels. We notice this starting in 40s and 50s in most men, and it's more common in men who are diabetic or have high blood pressure or sleep apnea, or what we would call metabolic syndrome. And low testosterone is associated with earlier heart disease in men. It's often underdiagnosed. Men are a little bit less willing to talk about their fatigue or concerns than we are. I just want to make sure we're okay.
Can you just ask them if they can see your PowerPoint presentation?
I'm wondering if everyone can see the PowerPoint presentation. If someone could answer that question, or they just see me and me talking. Okay. So I was just informed that you're just listening, you're just watching me. I'm watching these PowerPoint slides that I'm hoping that you're looking at. I don't think there's anything really that I haven't said that you're missing by not seeing the slide. It's usually they talk a lot more than what's just said on the slide. But what I was just discussing is andropause, which is low testosterone. And as you can see now that you're icy, now thank you for responding. Everyone can see it, good. So 20% of men over the age of 50 have low testosterone. And as I said, they're not in general as willing to discuss it as most of us. I would say most women, this is what we talk about with their girlfriends, is wanting to feel better and how our bodies are changing as we age. Men are a little bit more private. So like I said, both men and women make testosterone. Men make a lot more of it. They make it in their testes. We make it in our ovaries. And men, starting at the age of 30, start to decrease their testosterone production. And you can see it decreases a little bit year by year, 1 to 3% production per year. But women actually start losing their production in their 20s. So most females, their testosterone is the highest in their 20s, and we're losing it at a much more rapid rate than men are. I mean, if you think about losing 50% of something every year, that's a lot of testosterone loss. So our levels decrease rapidly and actually a lot younger than what you would think. We talk about in this office a lot, just, collagen is one of the main things we're concerned about. And we know that women start to lose collagen, women and men start to lose collagen in their 20s. But it turns out that's not all we're losing. The aging process starts pretty early. One thing to know about testosterone, one of the most important things, is not only does it make people feel better and more energetic, but it's also protective of bone health, brain health, breast health, and heart health. And this is some of what we're going to discuss later. But I think there's the kind of what we're improving in how somebody feels today, but also disease prevention for the future. So making people feel better now, and also, staying well for the long run. I think we all want to age, but you want to age, well. You want to feel well while you're doing it. So the good things that testosterone does for us. The number one thing that people are kind of looking for when they're considering testosterone therapy is increased energy and vitality. Most people describe an overall sense of just feeling better, a sense of well-being, less anxiety, less depression. People feel that they can focus better on the task at hand. Improvements of memory, and then it's also protective against prostate cancer, protective against breast cancer. It's protective against cardiovascular disease. And like I mentioned, it increases bone strength, muscle function, it helps reduce body fat, and it improves the cholesterol profile. Libido and enhanced performance is another added benefit. I would say, this whole list of things is the variety of things that people are concerned about and the things that testosterone may help with. So now on to menopause. Menopause is a period of time that term goes on for a long time. There's the childbearing years, and then there's premenopause and perimenopause, menopause, postmenopause. It can go on for decades, and it's just as we're aging, the body's changing, and we're making less and less and less estrogen. And there's never a time that it's just done. It's just kind of decreasing gradually over time, and because it happens gradually, not everybody has the classic symptoms. But most people over time definitely notice the loss of energy with loss of estrogen. We both, males and females, need estrogen. We don't ever have to supplement estrogen in men, but in women it can be really helpful as we age. We go from making a whole lot of it to not very little, and it has many positive effects throughout the body. My mom may kill me for saying this, but my mom's a neuroendocrinologist, and her life's work was basically estrogen and how estrogen affects the brain, and specifically learning and memory in the brain. And even when there was some controversy about estrogen in the past, she was using estrogen, and I was always concerned. I was like, how do you know that it's good for you when there is some suggestion out there that it might not be good for you? And she, at that time, was adamant that she didn't really care. She wanted to feel well, she wanted to have good memory, she wanted to sleep, and she wanted to function really well. So kind of she was ahead of her time in signing up for estrogen therapy, many years ago. And you'll see later that people around the world and other countries have been supplementing more than we have here. But estrogen helps control hot flashes. It actually helps maintain bone density. It becomes less of a concern if estrogen levels stay high. Helps with memory and learning. Maintains collagen in your skin, and we definitely all want more of that. And also very important is it increases serotonin levels. And why this matters is like the number of patients that come in our office every day that are on medications to increase serotonin levels or make us feel happier. So serotonin reuptake inhibitors, medications that increase serotonin, like Prozac or fluoxetine. There's a whole category of medications that people are on to increase these hormones, and estrogen can help with that as well. So what are the things that we worry about? I think most of the worry about estrogen replacement is based on oral estrogen supplementations, because that is what's been available to most patients over the last 20 years. But definitely taking oral estrogens can increase breast tenderness. It can increase the risk of endometrial cancer and breast cancers, as well as heart disease. Specifically, if anyone listening has ever taken a birth control pill, people know that they have to be, that they're at higher risk for blood clots and those kinds of things. So there definitely are some negative side effects. These things are very uncommon, but they can happen with oral estrogens. And we're not talking about oral estrogens here, but this is part of why there's some kind of negative connotation about having more estrogens. Interestingly, 1 in 7 women die of heart disease before their age of menopause, which is pretty incredible. That's really the leading cause of death in women. And that number gets even higher after menopause. So 1 in 3 women are dying of cardiovascular disease. And this has been true for a very long time. And although I would say most of us worry about things other than cardiovascular disease really is our main worry. This is the thing that we really need to be concerned about and that we need to work on preventing. And we know that estrogen is protective in cardiovascular disease specifically. So I mentioned the difference between taking oral estrogens and other methods. So there's also synthetic and bioidentical. Synthetic medications are compounds that are made chemically to be like the hormones that we have, but they're not the same. They're a semblance of. There are hormones that are available in pills and patches and also injectables. The difference is with bioidenticals is the hormones are exactly the same as the hormones that we produce in our own body. So if you were to look at the molecular makeup of estrogen or testosterone, it's exactly the same as what's circulating already. It can be delivered in pills, patches, creams, gels, or pellets. Specifically, what BioTE is using is pellets, and the reason for that, I'll go through that specifically, why that works better than some of these other mechanisms. Up until now, I think the patch has been a really good delivery system for some people, but not everyone can handle the adhesive on a patch. It is a consistent delivery system, but it doesn't deliver the same, kind of amount for everybody. Not everyone absorbs it the same way. And it's a little bit unpredictable, is that someone has to think about changing it, on a schedule, and that doesn't always happen as it needs to. And patches, I know from some people who use them, they don't stay, where you put them, or they're, when you change your clothes, they come off, or you're wearing your bathing suit and it, floats away in the water. It's not as predictable. So the patches have been a good way to deliver a bioidentical, but I think less efficient and less effective than the pellets. Creams and gels, anyone who's ever used these knows that it's really difficult to deliver an exact amount, to measure a cream or a gel and make sure that you're getting the amount that you think you're getting. Depending upon where you apply it, you're losing some of the application on your hand or on your clothing, or on your loved one or your pets. I mean, the chemical can be transferred anywhere. Your skin doesn't absorb 100% of it immediately when you put it on. So knowing exactly what's getting delivered is difficult. It also has a very short half-life, which means it doesn't last very long. So kind of timing it, to get what you want to get to make you feel better at that moment is a little bit more difficult. And finally, using it topically is not cardioprotective. If one of our main goals is to stay as healthy as possible and feel as well and prevent disease, the topical estrogens don't help that way. Testosterone can also be delivered in creams and gels. And similarly, it's hard to know exactly how much someone's getting, and it doesn't last very long. After the other option of testosterone, other than putting it topically, has been injectable. It used to be injected in an intramuscular fashion, which is pretty painful. And then eventually oil-based delivery systems, more in a subcutaneous fashion, but it has to be injected at least once a week, and for most people more often than once a week. And again, the problem with the injectable testosterone is people get peaks and valleys and peaks and valleys and peaks and valleys rather than a significant stable level. I have a great slide in a couple slides that will show what I mean by that. But also the injectable is more toxic to the liver, and it actually is detrimental to the lipid profile, so it can elevate cholesterol. And again, the type of testosterone is manufactured differently. And bioidentical hormones that we're talking about this evening are plant-based. These are made from yams, and again, the molecular structure is absolutely the same as what is circulating in your body currently. The great thing about pellets is the durability. They last 4 to 6 months, so it's not something that you have to have done on a weekly basis or a bi-weekly basis, not something that you have to take in a pill every day. And most people get 4 to 6 months out of the treatment. The pellets have been widely studied for a really long time. They were first developed in the 1930s, so it's been around for a long time, and they provide a steady stream of hormone in your blood. So because of where they're placed in your subcutaneous tissue, you're just absorbing a little bit all the time, and it's based on cardiac output. So we individualize dosing for every person. Once someone is interested in this kind of therapy, we send a whole bunch of different labs to look at many things other than just estrogen and testosterone to make sure we're optimizing your wellness, as much as possible. But the individual dosing is based on not just body weight, but also cardiac output activity. So someone who's super, super physically active is going to use more hormone than someone who's sedentary because their cardiac output is higher. And if you can imagine that cardiac output is just blood flow, and the more active you are, the more blood flow there is, and the more hormone you're going to absorb. So the great thing is you get the delivery of what you need depending upon how active you are. If you're running today, you're going to get more than you're going to get tomorrow if you're sitting on the couch. So it's kind of like a supply and a demand situation. And it's just underneath the skin, so it's not something that you feel or that anybody would see or anyone else would know that you have. And it just absorbs slowly over time as your body's using it. And this is what they look like. The estrogen pellets are really very small, and the testosterone is slightly larger. And like I mentioned, the pellets have been used since the 1930s, when people who were doing hysterectomies realized that women didn't do well with an immediate, kind of cut off from their oxygen supply, their estrogen supply, which feels like oxygen sometimes, the hormones. And so it was thought that replacing that would make people feel better. And this was actually starting to get more and more widely used in the 40s and 50s until Prempro came about. And it seemed at the time that there was a lot of interest in just taking an oral supplement. And unfortunately, a lot of the studies that have been done on hormone replacement therapy have been based on Prempro, which most people agree, Premarin, which most people agree is not the best estrogen to be given. It's made from horses, which is not as identical to humans as it could be, and the oral ingestion isn't the best way to give it. So, unfortunately, the data on estrogen, a lot of it is related to Premarin, which is really a different delivery. So people have known for a long time that estrogen and testosterone make people feel better at the time of menopause. And these are widely used in Europe and Australia. And something of note is, I'm always interested if something is FDA approved. And testosterone and estrogen are both FDA approved. What they are not approving is the exact dose that we're delivering. And the place that makes the pellets, there's something called a 503B pharmacy that is regulated by the FDA. So it's important for us and for anybody who is using any kind of bioidenticals or any kind of compounding pharmacy to make sure that it is a 503B certified pharmacy, to make sure that what you're getting, what you think you're getting. And in order to be certified at 503B, they actually have to subject themselves to internal and external audits on a regular basis, so that we know that what you're delivering is what we say you're getting. So the whole process is very, very well regulated, even though the actual dose that we that we may prescribe specifically for you that gives us some leeway to give you the dose that you need. And this is what I think is the most telling about pellets versus other delivery mechanisms. And it would be similar if we put an injectable testosterone or a topical testosterone on here. That basically with any of those other delivery methods, you're getting like a whole lot of it and then none of it, and a whole lot of it and none of it. So people feel great and then not great, and great and not great, great and not great. The patch does a little bit better job of this, is that there is a peak, and then as it starts to wear off, a valley, but not quite the peak and drop that you get with orals or injectables. But the implant is just to keep you at a steady state, that you're getting delivery of what you need all the time rather than the highs and the lows. So specifically, BioTE is simply testosterone and estradiol, so it's the right type of bioidentical hormones, individual dosing for each person. And again, this is based on your symptoms and your labs. It's like a 3-page of lab information that we're looking at to make sure that we're delivering what's best for you. And then the pellet system, so that you're getting a constant and delivery of what you need. Pellet therapy has been around, since the 30s and 40s. This company specifically, BioTE, has implanted 1 million patients. So it's not new. It's been in other states for a long time. We are the first people to bring it to Maine, and actually the reason that we started looking at it in the first place, because specifically patients were asking me, well, why aren't you doing this? I have to drive all the way to Massachusetts to get my pellet therapy. And I feel better than I've ever felt. And so we started reading about it and investigating it, and I started learning, more and more and more about this specific method. So it's actually driven by our patients, is why we're currently offering this therapy. So it's safe. It's been around a long time. The levels keep people even. It's much easier for someone to be compliant because it's something that you have to do 2 to 3 times a year to get your therapy. It's not, not something that you have to do every day. It's not injections. It's not painful. It's really, a low maintenance delivery system. And it's also one of the things that comes up is the cost of these things. And anyone who's used either topical testosterones or estrogens, they're very expensive and not always covered by insurance. And so this is actually, if someone's using alternative therapies, this can be not only, be better for your biology, but also it can be less expensive than some of the other modalities. The side effect profile is low, so complication rate has been incredibly low, and it's the very best method to increase bone density. And this is definitely a concern, for most of our aging population, making sure that our bones stay healthy and strong. Interestingly, there's not an increased risk of breast cancer, and it does not stimulate the breast tissue. And I would say this is the number one concern that people have when they hear the words of estrogen or hormone replacement therapy. That's the main thing people are worried about, is breast cancer risk. And there has been no increased breast cancer risk in people who have had estradiol pellets placed. It does not stimulate breast cancer growth. And there's also no increased risk in blood clots, heart attack, strokes, or other kinds of cardiovascular diseases. And it's hard to grasp, because it's very related to similar to what's happened with breast implants. If we think that something's wrong without having all the data, it kind of persists and persists and persists. And I think that now we do have enough data to prove that these things are healthy and can actually improve people's disease profile in the long run. So pellet therapy is protective to breast, bones, brain, and heart tissue. And this has been studied in hundreds of different studies, and we actually have a whole archive of medical literature and studies, because we want to make sure that that we're all on the same page, and that we're definitely making people not just feel better, but also healthier in the long run. So there's been some good studies, this is just one specifically showing that testosterone pelleting actually prevents the stimulation of breast tissue and lowers breast cancer risks. So the take home really is that the pellet delivery system is not the same as oral delivery systems, and the actual molecules are not the same. So what we're talking about is molecules that your body makes, that we're putting where your body can use them the way that your body knows how to use them. These are the things that I find pretty compelling, is the way that testosterone and estrogen actually help with bone health. And testosterone is the bone builder. We know that lower levels of testosterone increase somebody's risk for osteoporosis. This is what's happening to our bones as we age over time. And we know that we can improve bone density by supplementing estrogen. The longer people have had their pellets in place, the better their bone density. So 3.5% per year per patches, and 8% per year with pellet therapy, which is pretty substantial improvement of bone density. The other big one in aging is Alzheimer's and dementia. And most of us are aware that women are much more likely to get Alzheimer's disease than men. And if we are on estrogen, our chances of developing it decreases significantly. So not just for bone health, but also for brain health. We also know that men with low testosterone are much more likely to develop Alzheimer's disease. So both of these hormones have a big role in protecting our brains and keeping our brains healthy. This is just another study from the 90s showing that estrogen replacement with pellets improves cholesterol profile. When we talk about a good cholesterol profile, we want high HDLs and a low overall cholesterol. We know that estrogen replacement is effective at improving cholesterol profiles, and that testosterone has been shown to decrease fat mass over time. So there are some favorable things in cholesterol profiles as well as fat. And like we mentioned before, that the protective effect on the heart has been well demonstrated. Arthritis, and this reminds me to tell you that that testosterone is actually anti-inflammatory. Kind of the word inflammation, I think, has become more and more mainstream. That part of what we're doing by trying to eat healthy and whole foods and to exercise is to not just to increase that we're feeling better, but to decrease inflammation. That the less inflammation that we have, the healthier we are. And testosterone is an anti-inflammatory, and it helps decrease overall inflammation. So it helps with arthritis, and arthritis is a huge problem. I mean, all over the world, but it's one of the leading causes of disability. So anything that we can do to decrease our chances of arthritis, and both testosterone and estrogen are protective against arthritis. And some people, after being pelleted, notice within a couple months that their arthritis symptoms of arthritis have improved. This looks like a really complicated slide, but the main thing I wanted to remind myself of is that when we check labs, any lab, whether you're looking at thyroid hormone, like T3 thyroid hormone, or testosterone, or any normal lab profile, what's considered normal is basically what we use in medicine as the bell curve. And then this few percent, 2 to 5% over here is too low and abnormal, and this 2 to 5% over here is too high and abnormal. But you can see, like, the normal range, someone who is low on something like T3 or testosterone, or things that we know make people feel better, it's normal if it's over here, but aren't they going to feel better if they're on this half of the curve? So that's the goal here. These numbers that you see here are testosterone levels, total testosterone levels in men, and these are all considered normal levels on a lab test. But certainly the person who has a level of 231 over here, he's having dysfunction, and really doesn't start to feel better until he's kind of crossed what we consider the mean or normal testosterone level. So the higher levels are actually associated with better health and decreased risk for long-term disease. And you could do the same thing if we were talking about thyroid, that a lot of people have had their thyroids checked, and we look at TSH to see how much the body is working to try to make thyroid hormone, but also looking at T3 and specifically T3, because that's what's giving you the positive effects of having the thyroid hormone. If your T3 is over here, you're not going to feel as good as if your T3 is over here. So it's all normal on a lab, but we want to optimize what is normal to what feels good to each individual patient. So I have a question of, does BioTE reverse symptoms in older age, or does it level off where it is? So as far as reversing symptoms, I mean, I think at any age you can feel better. I mean, reversing symptoms, that's a good question. I mean, yes, we're in men, this list of things here, can we reverse erectile dysfunction, depression, all these things? Yes. Can we improve cardiovascular risk? Yes. It's not too late. It's not too late to make things better. Yes, if you wait until you have Alzheimer's, you're not going to be able to undo that. But I think when you're on the lower curve, there's definitely time for improvement. So I guess I don't think of it as anti-aging. I just think of it as improved aging. We're still aging, but if you can improve it in any way, I think of more of it as an improvement rather than a reversal. So this is just to demonstrate that different levels, although they're all normal, higher is better. It's more protective against more. Concerns that people have with hormone therapy, what's going to happen when they get their insertion. There can be some fluid retention that happens more in women than in men. It's not a very common problem. It happens less than 2% of the time. Very occasionally, it'll be significant enough that someone might need a diuretic for a short term while they get used to the medication, but that's pretty uncommon. Less than 2% of people have that problem. If we are supplementing estrogen, there can be some breast tenderness. In anyone who has a uterus and needs estrogen, they also have to be on progesterone to protect the uterus. You can't be postmenopausal and just take estrogen alone without protecting the uterus. Then you are increasing the risk of uterine cancer. Sometimes people do experience some emotional changes early on. Pellet extrusion is very uncommon. Sometimes with high testosterone levels, people may experience some hair growth or some acne. And certainly this isn't something that we are recommending to anybody, or anybody would recommend to someone of childbearing age who's trying to actively get pregnant, or any of those kinds of things. One question that we get sometimes is, can you use BioTE if you're on birth control? And you absolutely can. It doesn't prevent
prevent you from being able to have BioTE, and it's not protective against pregnancy, so you can do both. So, I mean, a hormone imbalance can happen at any age. It just happens to be more common as we get older. And not all therapies are the same. So testosterone is not testosterone is not testosterone. It depends upon, you know, how it's made, where you're getting it from, what the source is, that you're delivering what you think you're delivering. So making sure that the dosing is not just, you know, the proper dose, but that the patient is actually going to get the effects from that dose. And it's definitely not one size fits all. I mean, the key is really getting people to feel the best that they can feel. And not everybody has the same concerns or the same goals. I'm a pretty conservative person, so I'm always, you know, kind of start slow and add things on. One of the things that we were surprised when we checked just our labs of, you know, the 4 of us here in the office is that all of us needed D3, all of us needed thyroid. I think all of us needed the B12, and we were deficient in a lot of things. Even though we eat a healthy diet, I feel like I'm pretty healthy. I exercise, I do a lot of things I'm supposed to, and I was surprised just some of the baseline things, you know, weren't kind of optimized. So I think it's optimizing more than just your hormones, and certainly, I mean, absolutely, you know, eating well and, you know, staying physically active and, you know, all the wellness things that I think most of us, if you're tuning in, then you're aware of a lot of those things. And that's all part of kind of the overall wellness. And this is just, you know, these are just one, you know, a couple components, optimizing your hormones. But these, when you come in for a consultation, we would check all of these things, and our goal is to optimize, you know, every bit of it, not just one component of it. So I have a question on, let's see. If someone decides to use this treatment, is it a lifelong treatment for a period of time? So kind of like anything. I mean, you're going to benefit while it's being replaced, and then you're going to notice that you've lost the benefit once it wears off. So you're not net negative. You've been protected for that time that you're on it. You know, I think most people feel so much better while they're on it that 75% of people who start keep going because they feel great. So it's not that you end up behind. Similar to any, like a Botox or filler or any of those kinds of things, you know, you see the benefit right away and it lasts for a certain period of time, and then it goes away when you're not using it, but you don't end up behind. If anything, you end up ahead because you prevented that aging while you were doing those treatments. So there's not a lifelong commitment. It's just, you know, you want to feel your best as long as you can feel your best. Because these hormones decrease over time naturally, it's not like you're gonna feel great and then, you know, plummet to the pit of despair. It's going to be really gradual. And most people who are using this therapy, they don't need labs to tell, you know, where they are, where their testosterone or where their estrogen is. They're able to feel, you know, that they are feeling less and less and less good. So there's no reason that you can't, you know, stop. As far as what dosage people need, it's blood testing only. There has been some really good studies. It's been questionable whether you could tell in saliva or in other skin cells or nails or hair what hormone levels are. And the blood testing is kind of the gold standard to tell exactly what's happening. So we're looking at estrogen levels, but also FSH, you know, total testosterone, free testosterone, from a thyroid standpoint, the T3, T4, TSH, vitamin D levels, B12 levels, and those numbers are giving us a starting point. So it's not that we're going to nail it every time and make everybody feel perfect, but hopefully we'll get you close enough. We check labs the first time that someone's implanted. You'll have a lab check at 6 weeks, unless you're not feeling like it's made a difference. We give it a good 4 weeks. Most people feel what they're going to feel by that 3 to 4 week mark. One of the questions is how quickly do people feel better? It usually takes 3 days to 3 weeks. And if you're really not feeling any better at 3 or 4 weeks, we would recheck your labs at 4 weeks and probably add some more of the hormones. Once we know what your dose is, it's not something that we have to check labs for all the time. Is there any pain with the procedure of getting the pellets? Actually, very minimal. There's a little numbing medication, and the whole procedure to get the pellets for women is like 1 to 2 minutes, and for men maybe 3 to 4 minutes. The reason it's longer in men than in women is because they need more testosterone. So it takes a little bit longer to get those number of pellets in. In general, females it's a minute or 2. We place them in the backside, kind of not where you're sitting, but where there's a little extra fat on the upper buttock area. And everyone that we've done so far is like, oh, that's it, that's done. I mean, less than any other injectable you've ever had in here, because it's really quick. It's one shot, and it's one location, not like fillers or Botox where we want to get everything. It's quick, and it's really painless. There is some limitation in activity that first 2 to 3 days after the implants are placed. You can't do any high impact activity, no squats, lunges, definitely no bike riding. Normal walking is fine, but not anything heavy using those gluteal muscles because it's close to that fat pad. We just want to leave it undisturbed while it's healing. It kind of just feels almost like a tiny little bruise in the area. It's not painful, not a big procedure. It's pretty quick and easy. So how long does the screening take before you get the treatment done? So labs for women actually are coming back in 24 to 48 hours. For men, it actually takes a week because of the way that we have to look at their testosterone a little differently. For example, we labbed somebody yesterday who's coming back in for her pellets on Friday. Some of it is that there's not an emergency, obviously, to get your treatment, but in general, people want, once you know, and you want to feel better. So within a couple of days, you can actually get the labs and get the treatment. It's a good question. Does insurance cover any of this? Sometimes the blood testing, yes, that's true. It is possible that your insurance may cover the blood testing. We actually have a really good contract with LabCorp, which I a while ago developed an association with BioTE, and so the labs cost $150 for the panel. And like I said, it's like 3 pages of labs. I think I have. I'll show mine. So I'm not sharing anything, but you're checking a lot of different things. And it's $150. And if anyone has had labs recently, even through LabCorp, if you go through your insurance, it can sometimes be more expensive. So we're happy to submit it to your insurance, but with the way that deductibles work, it's possible it could be a lot more expensive. So if you're interested in that, I would find out exactly what your specific insurance company would charge for that kind of a thing. Just trying to make my questions bigger here. I can see that there's a couple more. So, okay, so the screening, does insurance, yeah, I think we got all the questions. Yeah, it's pretty quick. There's a courier who comes every day and picks up our labs, and it all goes through a portal, so it's electronic. We go to a website to see the labs, and then we actually plug the labs in to individualize your dosing. And obviously, I'm responsible for all of this, so I take my time and look through and make sure that we can kind of meeting every patient's needs, and I think more isn't always more. We want enough so that people are feeling better, but not more than what you need. Any other questions I can answer? I think, and I guess the main things, there are a couple handouts. The cost, okay. I actually asked Ashley before we started. I was like, I have to know how much this costs. So the labs, the initial labs, it's $150. So that includes coming in, filling out all of the questions that we need to know to know if you're a candidate and what specifically we're looking at to improve. And it's you'll usually see Sarah for that, and she'll draw your labs. She's excellent at doing that. And that's $150 for the labs. Once we get the labs back, we'll call you and let you know what we think we can optimize. And then getting the pellets is $500 for women, and it's $800 for men. And again, the difference in price is that men require a lot more than women do. Men are lucky in that the pellets that they do get last a lot longer. So they usually can go 5 to 6 months, and women, it's usually 4 to 5 months between pelleting. So that's the cost. The labs at the 6-week mark are a little bit less. I don't know exactly what that number was, but I want to say it was almost half, because we don't have to look at everything all over again. We're just looking at the things that we're working on. Obviously, if we're adding vitamin D to your regimen or a thyroid hormone, we want to check that and make sure that we've gotten you to an optimal level, not just the testosterone and estrogen levels. And once someone is kind of cruising along where they are, you don't have to keep getting the labs. Any other questions? So how long does it take to feel the effects? So what we have experienced in this office has been about 4 or 5 days. In the literature, people say 3 days to 3 weeks. If there are some people who are really quick responders and feel better immediately, some people it takes up to 3 weeks to feel better. And like I said, if it's 4 weeks and you're not feeling any better, then we probably haven't given you enough. So that's when we really want you to come back. Everyone who gets their pellets gets a phone call at the 4-week mark to make sure that you're feeling better. If you're not, we would bring you back in and augment the treatment for you. If you're feeling great, then we have you back at 6 weeks to make sure that we've hit all of our marks, take the labs, and then we just repellet the next time without making any changes. So most people feel better pretty quick. And I think it was Sarah, maybe it was yesterday, she was like, do you think it's placebo effect, or do you think I feel better? Like, she feels more energized, she feels more patience for her child at home. She just, feels like she's getting more done. And those of you who know me know that I go to bed at like 8 o'clock practically every night. And last night I got home and I built a fire, and I was actually able to sit and read in front of the fire until 9:30, which is pretty rare for me. So it's only been a week, and I mean, most of us are really feeling the difference already. I have another question. Is each dose in the same place? No. So the options for placing doses, I mean, in general, it goes from one buttock to the other. So we start with the right and then go to the left and then go back to the right. It's a tiny little, 2 millimeter mark where the pellets go in. If someone really doesn't want it back there, it's possible to put it in your abdomen, as long as there's enough, fatty tissue there. It's important that the pellets are in the fatty tissue and not in the muscle. So most people have enough fat on their upper backside to kind of keep it out of your way, so you're not sitting on it, not leaning on it when you're sitting down, and it rotates from side to side with each treatment. But there's no physiological reason it can't be put in the abdomen. So many good questions. I mean, it's a super exciting topic, and I would definitely encourage anybody who's thinking about it. Really, starting with the books that we have here. Everyone who's on this webinar is welcome to come pick up a book, and we would love for you. Like the more you read it, the more you're going to be interested. And the other thing is handouts. There are handouts with the most frequently asked questions from the company, as well as what insertion instructions would apply after the treatment. And their educational videos are actually excellent. So at BioTE education videos, you can find that link on this webinar also. But I definitely would encourage you to look at that. And there are some visuals of the procedure, and I'm sure soon we'll have a picture of our visuals of us doing the procedure on our website as well. But anybody who's interested, I definitely would encourage you to look at the material and read about those things, and we'd be happy to discuss more. And like I said, we're also, all of us are happy to talk about our personal experiences as well. I think that's it. I don't see any more questions. Certainly, if you have questions, give us a call or email us at info@hollandplasticsurgery.com, and we're happy to answer anything we can answer. You could probably tell I'm pretty enthusiastic about this. I think it's exciting to be able to optimize the basics so we can all get to feeling as good as possible. And thank you very much for joining us, and I hope to see all of you soon. Have a good night. Stay safe tonight.